We cannot successfully address anything that we don't know about.
Pennsylvania State Senator Art Haywood is reacting to the NBC10 Investigators report on domestic violence. We found that most hospitals in the tri-state region do not keep or report data on domestic violence, either the number of survivors that come through the doors or the type of injuries. State laws don't require them to do so.
Hospitals not having a record of incidents means that we are that much less prepared to address domestic violence.
Haywood is echoing what we heard from the head of forensic nurses at Abington Hospital and one of the people who raised the issue of hospitals not tracking domestic violence cases.
It's that dirty little secret that we still want to keep hidden underneath, and as long as it stays underneath, it's going to stay there, right? It's never going to go away.
Nurse Karen Doherty's team keeps its own statistics on the number of domestic violence victims they treat. Haywood plans to introduce legislation in the spring that would require some uniform data collection system for hospitals.
I'm going to talk to some of my colleagues about how we can adopt this legislation that would address what you found. I can't thank you enough for finding it.
On the other side of the state, Pennsylvania State Representative Natalie Mihalik says she plans to meet with hospital officials and perhaps hold a hearing.
Hey, is this something that, you're willing to do? What is the best way for, this to be implemented? What is the additional, manpower behind it? And what's the cost on the healthcare systems?
She believes tracking data on domestic violence is helpful in responding to the problem and preventing abuse. But she sees some challenges with asking hospitals to keep stats.
A lot of times victims are just reluctant to either, admit or, tell somebody that they have been abused.
The Pennsylvania Hospital and Health System Association tells us it is taking a deeper dive in examining the issue raised in our report. Across the river in New Jersey, State Senator Joe Vitale is also adding domestic violence legislation to his spring agenda. Vitale says that since the NBC10 Investigators story aired, he's been speaking with domestic violence advocates.
They know what the best practices are, and they know what it is that we should do going forward.
We checked with the New Jersey Office of Domestic Violence Services. Its spokeswoman says they support efforts to better identify and quantify domestic violence incidents, as long as the victim's confidentiality is protected. Vitale says he will follow the advocate's advice.
We'll draft legislation, we'll have a hearing to discuss them, and then likely vote them and move the process along.
The New Jersey Hospital Association responds in part that documenting cases of domestic violence is a nuanced and sensitive issue that first and foremost must respect the individual's wishes and privacy. The association says it is committed to working with state lawmakers on the matter. For the Investigators, I'm Claudia Vargas, NBC 10 News. Count on it.
And you can see our full investigation on domestic violence by going to NBC10.com/domestic violence.